So according to the private company that runs Saskatoon's ambulance service, every day in Saskatoon, 911 operators are forced to tell callers there's no ambulance available.
This should be something that should alarm everybody, but with no more resources being available, it's something that we've just come accustomed to dealing with on a daily basis.
Andrew Williamson says since 2015, Saskatoon has had 11 ambulances to serve the whole city. But in that time, the population shot up and a meth crisis has exploded, but there have been no new ambulances added. And Williamson says in order to keep up, the city needs 4 new ambulances. It's a request he's made to the Saskatchewan Health Authority.
There is a financial deficit within EMS in the province, and at this time I've got no indication that any ambulances are on the way.
The lack of ambulances is affecting the time it takes for an EMS crew to get to your door. Now, the national benchmark says ambulances should arrive in less than 9 minutes 90% of the time. But in Saskatoon, ambulances met that standard about 70% of the time, not 90. Response times to the outskirts of Regina are actually a bit worse. The standard is met in North Regina 69% of the time, in the south 63%, the east 72%, and the west 68%. Regina EMS says the pressure on paramedics in the city is intense. Last year, 11 of them quit.
We lose people every year, but that's one of the highest years that we've ever had.
Yeah. And what's your understanding of what's going on there?
Well, when we interview these people, they tell us it's because of workload.
CBC asked the provincial government about the request for more ambulance funding from both Regina and Saskatoon. It didn't answer the question directly, instead noting that the province is in the midst of a modernization and standardization initiative. Jeff Leo, CBC News, Regina.